my favorite times of the week. It's time to bring my good friend, Dr. Joe Congini, onto the show. Sports Medicine Center, Akron Children's Hospital, diving into the world of sports medicine. Dr. Joe, what do you have for us today?
Hey, Ray, you know what? If you hang around long enough, you will ultimately, some of these things come back. And I feel like it's deja vu all over again for me with the debate that I've kind of gotten in the middle of seeing what's going on. And it has local ties, so I wanted to talk about it again. I kind of promised you and your audience 9 months ago we would talk about this issue. But 25 years ago in the 90s, I was a little more closely involved in some of the sports medicine groups and the cardiology groups and the Heart Association with sudden cardiac death in young athletes. We know the number one cause of why athletes die when they're playing sports comes from the heart, and there's some genetic conditions that lead to this. And at that time, there was a lot of discussion. We were on, got a lot of input from the cardiologists. And when people are, of course, in strenuous activity is when these things occur. And now all of a sudden in 2024, especially 2025 and the early 26 here, there's been a flurry of new studies and meetings to consider, do we need to change our approach to screening people for these cardiac conditions before they play high school sports? If you remember, the way we approached it in the 1990s, the way the cardiologists decided is that if we did a good detailed history, family history, near passing out episodes, things like that, then everybody should get a workup with an EKG or an echo. We had AEDs that were new on the scene, and these life-saving defibrillators could be useful at saving lives, and they are still useful in saving lives. But the thought was that it was just too expensive. The monies could be used elsewhere in the healthcare field to test every athlete in the country, 35 million kids who play sports, with an EKG and an echo. And that has kind of stood for 25 years. Part of it was that when we did test kids, there were so many false positives. We'd pick up things that were questionable, and then they would need a full cardiac workup. And so that was the recommendation of our cardiology consultants, and that stood for about 25 years. What's changed in the last year to make everybody kind of relook at this? There was a study by the CDC and several other places looking at this, but approximately 2,000 young people die from sudden cardiac death with previously unknown conditions. They didn't have problems that we knew about. It was kind of unknown. But 1 in 300 people have these genetic heart conditions, and they would be at risk to be in that 2,000 people who die suddenly. And so that's what people have been looking at again. And although we say, hey, having AEDs around everywhere, but it's hard to have them around everywhere. And many times we don't know till later with some kids who die in sports whether theirs was a cardiac issue to begin with. So the current guidelines may not be enough. Many parents go out nowadays and seek these tests on their own before their kids play sports, EKGs and echoes. Secondly, the EKGs and echoes have gotten so good that they really feel there's less of these false positives where we'd have question marks, and that if you had that test done, maybe even just the less expensive EKG, it would cut that number down significantly of 2,000 kids, who pass away playing sports in the country. So that is really being debated. There were at least 4 articles that I looked at from late 2025 deciding whether we should change this. One of the things we used to say, if we tested all 35 million kids in the country, it would be millions of dollars to do that. Now the figure is $2 billion to test all these athletes, and could that money be better used elsewhere? So those are the kinds of discussions that go on. Those are the kinds of discussions that were going on in the 1990s. So, I feel like I'm living through this all over again. Some people are looking at some studies and saying maybe the COVID effect has actually increased why some of, there are higher numbers again of some of these kids that are dying with these heart conditions. Some people are saying, look at just the at-risk sports, and the 2 biggest sports by far are basketball and football, and maybe just testing those kids. So they're back to some of the debates that we had previously And I will certainly keep your audience up on that. But the reason there's local ties, and this is the heartbreaking part for me to even have to bring it up, but I promised you that we'd look at this. So last April, we looked at the fact that two local great young athletes had passed away within 2 months of each other. And initially, it's not always clear. This was a young kid from Avon who had won the state championship football player that was down at the University of Cincinnati, and a local kid here from Revere who had gone to Ohio State and then had transferred to UNLV. And all the evidence wasn't totally in. I went back and looked at the evidence, and the coroner report in both of those two cases came back in May and July of this summer, and both of those two were, in fact, cardiac deaths. And so what happens is many times these people, it's not looked up further, or people don't talk about it later, and that number that people talk about, which is 2,000, may actually even be higher. So I do understand why this is being reviewed again. You know, I'm kind of happy. We always have to learn and see this, and it's really high stakes when you're talking young athletes between the ages of 15 and 25 with these conditions. And so I will keep your audience updated. Really a shame with those two kids that we lost, but it's being discussed again whether kids should get EKGs or echoes to check their hearts before they play sports.
And, Joe, I know some schools will even make it available to families, and I know there's additional costs, but some school districts are even bring additional medical technology to come in and offer those services.
You are absolutely right. You know, we take care of children of several different high schools, and they will have a date where this group comes in and it's available for kids to be tested, and there will be 25 kids tested or families, or 100 families tested, where they'll want their kids tested. There's still some of those tests which come out, unclear after you do that kind of, in a mass screening exam, and then they have to go to a cardiologist for a full evaluation. But those types of screenings are definitely available, and we could get people information on those types of tests if they're interested down at the Sports Medicine Center at Akron Children's.
Perfect, Joe. Great information, Joe, and really timely and obviously very important as well when we talk about the young athletes. Joe, thanks again, my friend. Great timing. Terrific part again of the show. Great segment, and we'll do it again next week.
Okay, Ray. Talk to you next week.
You got it, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, joining us live this morning.